top 25 community care assistant interview questions, and 100-word answers. Community care assistants play a vital role in supporting individuals who need help with daily living, personal care, and emotional well-being. This role requires compassion, patience, communication, and the ability to work independently while ensuring people remain safe and respected. Preparing for an interview helps you demonstrate your commitment to quality care and your understanding of professional standards. Below are the top 25 community care assistant interview questions paired with strong, detailed 100-word answers. 1. Why do you want to work as a community care assistant? I want to work as a community care assistant because I genuinely enjoy supporting people and making a meaningful difference in their daily lives. This role allows me to combine empathy and practical skills while building trusting relationships with individuals who rely on consistent and respectful care. I am motivated by helping others maintain their independence, dignity, and comfort. Working in the community also gives you the opportunity to understand each person's unique needs and provide personalized support that enhances their overall quality of life. 2. What skills make you a strong community care assistant? I possess strong communication, patience, empathy, and active listening skills, which help me understand clients' needs and interact with them respectfully. My ability to remain calm under pressure enables me to respond well to challenging situations. I am organized, reliable, and capable of following care plans accurately. I also value teamwork and know when to seek guidance. Additionally, I am physically capable of assisting with mobility and personal care tasks while ensuring clients' safety and maintaining their dignity at all times. 3. How do you handle challenging behaviors from clients? I first try to understand the cause of the challenging behavior by observing and listening carefully. I remain calm, patient, and respectful to prevent escalation. I use de-escalation strategies, such as speaking softly, giving space, or redirecting the conversation. I follow the individual's care plan and guidance from supervisors. If necessary, I document the behavior and report it so the care team can assess any changes in health or environment. My priority is always safety, dignity, and compassionate support. 4. How do you ensure a client's dignity and privacy? I protect dignity by communicating clearly, asking permission before providing care, and ensuring clients are involved in decisions about their support. During personal care, I keep them covered as much as possible and complete tasks discreetly. I respect their boundaries, preferences, and cultural needs. I maintain confidentiality and never discuss private information with others. I also encourage independence wherever possible, allowing clients to do tasks themselves while I assist only when needed to preserve self-respect and autonomy. 5. Describe your experience with personal care tasks. I have experience supporting individuals with tasks such as bathing, dressing, toileting, grooming, and mobility assistance. I approach personal care with sensitivity and professionalism, making sure the client feels safe and respected throughout the process. I follow hygiene standards, infection control procedures, and a specific care plan for each person. I am attentive to changes in skin condition, mobility, or comfort levels and report concerns promptly. My focus is always on maintaining dignity while providing compassionate, high-quality care. 6. How do you manage your time when supporting multiple clients? I prioritize tasks based on urgency, client needs, and the care plan. I stay organized by following a clear schedule and preparing in advance. I remain flexible because unexpected situations can happen. Effective communication with clients and the care team ensures smooth coordination. I complete essential tasks first, but I also take time to provide emotional support and build rapport. I document activities promptly to stay accurate. Good time management helps me deliver consistent, safe, and person-centered care. 7. What would you do if a client refused care? I would stay calm and respectful, acknowledging their feelings and giving them space to express concerns. I never force care. Instead, I explain why the task is important and offer alternatives or choices to encourage cooperation. Sometimes clients need reassurance or time before accepting support. If refusal continues, I document the incident and inform my supervisor so the care plan can be reviewed. My approach focuses on empathy, safety, and respecting the client's rights and independence. 8. How do you ensure safe manual handling? I follow proper manual handling techniques, such as bending my knees, keeping a straight back, and using my legs to lift. I always assess the environment for hazards and use equipment like hoists or slide sheets correctly after training. I never attempt risky lifts alone and always ask for help when needed. I communicate clearly with clients before moving them to ensure they feel safe and prepared. My goal is to protect both the client and myself from injury. 9. What does person-centered care mean to you? Person-centered care means focusing on the individual's needs, preferences, routines, and values rather than providing one-size-fits-all support. It involves actively listening, offering choices, and respecting their independence. I tailor care plans to match their physical, emotional, and social needs. Person-centered care also emphasizes building trust, promoting dignity, and including clients in decision-making. This approach improves well-being, strengthens relationships, and ensures people feel valued and understood, not just cared for as tasks. 10. How do you maintain professional boundaries? I maintain boundaries by keeping relationships respectful but not overly personal. I avoid sharing private details about myself or becoming emotionally dependent on clients. I follow policies, avoid accepting gifts or money, and ensure communication remains professional. I respect clients' privacy and do not engage in inappropriate conversations or physical contact. If a client tries to overstep boundaries, I gently redirect the interaction. Professional boundaries help maintain trust, safety, and ethical care. 11. What steps do you take to prevent infection? I follow standard infection control procedures, including hand washing before and after each task, wearing appropriate PPE, and using sanitization practices for equipment and surfaces. I follow guidelines for waste disposal, handling bodily fluids, and maintaining a clean environment. I monitor clients for signs of infection and report concerns promptly. I also follow training on preventing cross-contamination. These steps ensure a safe and hygienic environment for clients and staff. 12. How would you respond to a medical emergency? I remain calm and assess the situation quickly to determine the risk. I follow emergency protocols, call for urgent medical help, and ensure the client is safe. If trained, I provide first aid within my competence level. I reassure the client and keep them comfortable until help arrives. Afterward, I document the incident and report according to policy. My priority is protecting life, following procedures, and communicating effectively with the care team. 13. What motivates you to work in community care? I am motivated by the opportunity to positively impact people's lives by supporting them to stay independent and comfortable in their own homes. I enjoy building meaningful relationships and providing emotional and practical care. Community care allows me to work closely with individuals, understand their unique needs, and adapt support accordingly. Helping people maintain dignity, confidence, and well-being gives me a strong sense of purpose and personal fulfillment. 14. How do you communicate with clients who have difficulty speaking or understanding? I use clear, simple language and speak slowly with patience. I maintain eye contact and use gestures, visual prompts, or communication aids such as pictures or written text. I give extra time to respond and avoid rushing them. If needed, I involve family members or professionals who understand their communication methods. Active listening and observation help me interpret their needs accurately. My aim is to ensure they feel heard, included, and respected. 15. How do you handle stressful situations? I manage stress by staying calm, prioritizing tasks, and focusing on what I can control. I use deep breathing and positive communication to maintain professionalism. If a situation becomes overwhelming, I ask for support from colleagues or supervisors. After the event, I reflect on what happened and learn from it. I also maintain a healthy work-life balance and self-care routine to stay emotionally strong. This helps me deliver consistent and compassionate care. 16. What would you do if you notice signs of abuse? I take any sign of abuse seriously and follow safeguarding procedures immediately. I document my observations accurately and report them to my supervisor or designated safeguarding officer. I never confront the suspected abuser or promise confidentiality to the client. I reassure the individual that they are safe and that I am there to support them. My priority is protecting vulnerable clients and ensuring appropriate authorities handle the situation promptly and professionally. 17. How do you support clients with dementia? I use patience, reassurance, and clear communication to support clients with dementia. I create a calm environment, reduce confusion with simple instructions, and follow familiar routines. I use reminiscence techniques and positive reinforcement to encourage cooperation. I treat them with dignity, even when they struggle to remember or express themselves. I monitor behavior changes and report concerns. My approach focuses on empathy, safety, and helping them maintain independence where possible. 18. Describe how you work independently. Working independently means managing my schedule, following care plans accurately, and making safe decisions based on training. I stay organized, assess risks, and remain aware of my responsibilities. I also recognize my limitations and know when to seek help or escalate concerns. I keep communication open with supervisors through documentation and timely updates. Independence doesn't mean isolation. It means being responsible, proactive, and confident in providing safe, high-quality care. 19. How do you build trust with clients? I build trust by being reliable, respectful, and consistent. I listen carefully to their concerns, show empathy, and treat them as individuals. I respect their routines, choices, and privacy. I explain tasks clearly and ask for permission before providing care. I follow through on what I say and always maintain confidentiality. Over time, these behaviors create a safe and supportive environment where clients feel comfortable and valued. 20. How do you support clients emotionally? I provide emotional support by actively listening, showing empathy, and offering reassurance during difficult moments. I encourage clients to express their feelings and validate their emotions without judgment. I create a friendly, calm atmosphere and participate in conversations or activities that help them feel connected. I also monitor changes in mood and report concerns to the care team. Emotional support is essential for well-being, confidence, and overall quality of life. 21. What experience do you have with medication support? I follow strict protocols when assisting with medication, ensuring accuracy and safety. I check the care plan, verify the medication label, and confirm the correct dose and timing. I never administer medication unless I am trained and authorized. I record each dose properly and report any refusals, errors, or side effects immediately. I also encourage clients to take medication as prescribed while respecting their right to refuse. Safety and compliance are my top priorities. 22. How do you deal with family members who are upset or demanding? I stay calm, patient, and professional, acknowledging the concerns without becoming defensive. I listen carefully and reassure them that their loved one's well-being is my priority. I provide clear, respectful information within my role boundaries and avoid making promises outside my authority. If needed, I refer them to a supervisor for further discussion. My goal is to maintain good communication and ensure families feel supported while keeping the client's needs central. 23. What would you do if a client fell while you were supporting them? I would stay calm, ensure the client is safe, and avoid moving them until I assess for injuries. I call for medical help if needed and follow the organization's emergency procedures. I reassure the client, keep them comfortable, and monitor their condition. I document the incident accurately and report it to my supervisor. Afterward, I review what happened to prevent future falls. Safety and professionalism guide every step of my response. 24. How do you handle confidential information? I follow data protection policies by keeping all client information private and secure. I only share details with authorized staff and never discuss personal information outside work. I store documents safely, use secure systems, and follow protocols for recording updates. I understand that confidentiality builds trust and is essential to ethical care. If I am ever unsure, I seek guidance to ensure compliance with legal and organizational standards. 25. Why should we hire you as a community care assistant? You should hire me because I am dedicated, compassionate, reliable, and committed to delivering person-centered care. I bring strong communication skills, patience, and practical knowledge of supporting individuals with daily tasks, personal care, and emotional needs. I follow safety procedures, maintain professionalism, and adapt easily to changing situations. My goal is to enhance each client's well-being and independence while representing your organization with integrity, respect, and a strong work ethic. A community care assistant plays a meaningful and rewarding role in supporting individuals to live comfortably and independently. By preparing thoughtful answers ahead of time, you can confidently demonstrate your compassion, professionalism, and understanding of person-centered care. Use these sample answers to strengthen your communication skills and highlight your commitment to quality support. With preparation and confidence, you will be ready to make a strong impression in your interview